I think the hardest thing when you're the mum of a child going through cancer treatment is that you can't make them better. So when you've got children, normally that's your job, is to make them feel better, and there's nothing that as a parent we could do. We just had to hand them over to these experts and hope for the best, basically, so that was quite difficult.
A lump had appeared on the inside of Ben's, just down near his ankle. So that was when we thought, yeah, just go to the doctor and get it checked out.
My little boy had a tumour in his cheek and it caused a facial palsy, so it was noticeable that he had a wonky smile, and that's how it was picked up.
When I was little, I used to run around a lot. I was a very active child. If I could run somewhere, I would, and if I could skip or jump, I would be doing that, and walking wasn't really a thing. After I got my leg amputated, that changed a little bit.
My diagnosis of my sarcoma, it was called conventional chondrosarcoma. Now, chondrosarcoma is where in my case, I believe, where the cartilage within my joint went a bit crazy and started multiplying itself and made itself into a nice little ball. In my case, bigger than a golf ball, slightly smaller than a tennis ball. And it was in my shin bone, around my knee. I had heard of sarcoma before. I didn't know anything else about it. I certainly hadn't heard of rhabdomyosarcoma. In fact, I didn't even know how to pronounce it until he'd almost finished treatment. Yeah, so there's a lot of different sarcomas out there, and some are more well known than others.
When I got into sailing, I learned that there was a sport I could actually do and do well.
I had a pain in my lower left leg, and I was playing a lot of cricket at the time, but it was really painful and I kept complaining to Mum about it.
I've ended up competing internationally as a blind sailor.
The night that Sophie had her leg surgery, which is really, really full-on brutal surgery, it's really, really intense. You know, you sign a form to say you give permission if the surgeons find something that's too complex, too severe, whatever it may be, that essentially you sign permission to let them amputate your child's leg if that's what they need to do.
I suppose what was amazing for our situation was that the physiotherapist that you actually went to had seen sarcomas a couple of times before, which is very unusual. Quite often physiotherapists may not see a sarcoma in their entire working life. He sent Hugh and Lee straight off to get to the radiographer, and then that's when, as Hugh said, things happen pretty quick.
What I did about it, well, no one could give me an answer for it. So in my mind, I thought, well, there mustn't be anything significantly wrong, because if it was something majorly wrong, at least one of them would have given a hint of something.
We should try and obtain what's called orphan status based on genetic diagnosis to get access to drugs for our sarcoma patients. This would be a huge step forward.
If you think that you've got a lump, a pain, or just an ache, and it can be anywhere in your body. Hughes was in his leg, but it can be anywhere at all in your body. So if you've got a lump of pain or an ache and it's persistent, you don't know what it's from, go to your GP and ask the question, could this be sarcoma? Because it might just be sarcoma.
The main message I would like to perhaps put across is that you know your child better than anybody else, and you know when there's something not quite right with them, and you don't have to take that first opinion. You can seek second opinion, perhaps a third opinion. Yeah, just perhaps don't give up.
I've lost my leg, but I've also lost cancer. I've survived sarcoma, and I've got probably 1.5 legs, but to me life is pretty normal.
The importance of socket sarcoma rests with its role and its missions. The mission of socket sarcoma is to raise community awareness support investment in research with the aim of improving outcomes for patients and their families.